Welcome back to Rohrich Knows Podcast, helping you become a better you. So today, it is a distinct pleasure for me to welcome back Sydney. She's now 2 years, almost to the day, after her rhinoplasty, and she's also gotten married, so it's no longer Sydney McNabb, it's Sydney Dodson.
Yes.
It's great. It's great. So welcome back.
Thank you so much. I'm thrilled to be back. Thank you for having me.
It's great. I mean, the last time you should tune in, it was about 2 months post-op, and you had your stereo strips on, and we had to take them off before you did it.
Yeah.
Before we did the podcast. So it's great. So how have you been? How have you been? I mean, it's been amazing. And I'm just going to show some of her pre-op and post-ops, and just give you an idea of the shape and contour. She's beautiful. How tall are you?
I'm 5'11".
5'11". So yes. So she's beautiful. She's got a beautiful face. And of course, we'll save the wedding for later. But so tell us about your journey. I mean, obviously, it's been 2 years almost to the day. That's amazing.
Yeah.
So tell us why you decided to have a nose job to begin with.
Sure.
I mean, you weren't getting married then, so.
Yes, I knew I wanted it before the proposal. So it happened about 6 months before the proposal.
It did?
But it wasn't just that. I remember, I think I was, 13, 14, when I really realized that this was going to be kind of a dream of mine.
Really?
Yeah, and it wasn't, of course there was always insecurities, but I just didn't feel like it fit my face. And I waited a long time until my life was in the right place, and I did a ton of research. You know how I get about research.
Yeah.
It took me about 6 months to finally commit and make the decision, and I watched every single one of your TikToks, Instagram posts, YouTube, vlogs, all the things, and I just felt like it was the right time. And honestly, I was watching you before this, and I was like, this man changed my life. Like, wow. I'm just so thankful.
So, well, you're great. You made my day. I mean, it's great. It's, we love what we do and do what we love. And so, and, the great thing is, Sydney is beautiful. She was beautiful before, and now she's just, slightly enhanced. So she looks great. But, no, it's good. I didn't know you waited. I mean, you were 13 years old?
Yeah.
So were you teased, or it was just you?
I was.
Yeah, girls are terrible.
Girls are mean.
They're
girls
terrible.
Are
I know. I have a
rude.
daughter.
But I will say, before the comments started, I knew I wanted it. So it didn't. I hate the word bullying, but those comments didn't push me into this decision. It was truly always my decision, which is why I always stayed confident in that it was nobody else but me who wanted this, and I made it happen.
Yep, I know. And she means it, because I've gotten to know her the last couple of years. You're a rock star. So and then so tell me, you went to UT, right?
Yes.
That's where you met your hubby to be? Oh yeah, of course.
No, I met him in high school. We got married 4 days before we hit 10 years together. So
you're kidding.
Yeah, we met before college, long distance for 5 years, and made it through, and the rest is history, right?
That's great.
Yeah.
That's great. So tell us about, the rhinoplasty journey. I mean, obviously the first week, I know it's been 2 years, and of course people forget, but the first week you had the splint on, and that came off, and Letty did a nice job in doing that, right?
Yes, we love
her. So tell us about that evolution, the swelling and all those things, that takes a while, it takes months.
So to your point, because it's easy to forget what happened 2 years ago, I decided to go through my camera roll before this to kind of jog my memory. And wow, it has changed so much.
Yeah.
And I thought that even a week after the splint came off, that it looked different. And then days after that, like each day there was progress. And now I feel like I look even different from a year ago, of course. But the first week was challenging. The first couple of weeks were challenging, and I said this in my last podcast with you, but it's all about preparation for me, is what made my recovery process easier than what, maybe it could have been if I hadn't prepared properly or appropriately. So it's all about support. I had Brandon and my family close by, and then I had the list of vitamins that I had been taking per your recommendation for the weeks prior, and then of course buying the materials beforehand. And the bed wedge and the cleaning supplies and all the things. So I got home and I was fully prepared to have time to recover fully, and that's what happened. We didn't have to go and buy more things. You were on call. I remember FaceTiming you once or twice with questions.
Yeah, I give myself. Yeah.
And I would say, while it was challenging, of course, it went relatively well.
Yeah, no, it was great. You did great. And, I give all my patients my cell number, and you really didn't, I think we talked a couple of times, but it's fine. I mean, it's just comforting. And the great thing is you could FaceTime, you say, hey, it's just swelling normal, and you go, yeah, of course.
Yeah, that's exactly what it was, just reassurance.
And I, at one point that you really made that I think is so important that people need to hear and they don't listen is it takes time. It takes time. It takes weeks to months. It's 2 years. It's beautiful. I just was looking at your wedding photos. I mean, oh my God, it's, the sign of great plastic surgery is that it just looks like you. It looks like you.
I feel like me.
Well, it is you.
I know, it is me. It is me. It's an improved version, but I just feel like it's so natural, and it was what I had imagined. But I'm really happy with the progress, and looking back on photos, I feel like where I started from, and then even 6 months and in a year, and then it has changed drastically. But I feel like I'm fully 100% done with everything, and I'm very, very content with where I'm at.
Yeah, no, it's great, and that's how it should be. I mean, and it looks beautiful. So, so I think that's great advice, and it's just a tincture of time, and and there's nothing you can do other than just let time go by.
Patience.
I know that's
my favorite word.
That's great. I'm going to just send everybody to this podcast. Yes, it's patience. Yeah, it's a patience is a good thing in plastic surgery, but in life too, right?
It's a hard thing to practice, isn't it? It's quite challenging, but patience, especially in a recovery process, is crucial, because you're wanting to wake up the next day and feel normal and look normal, and swelling's gone. And it did take me a full 8 months to a year for truly all the swelling to be gone, which is normal.
Right.
But it was all about patience, and some days were easier than others, but overall, that was one tip that I could recommend to everybody, is just trust the process. Trust the process.
That's right. Oh, that's so true. And that's the most common thing I tell my patients every day is, trust the process. It looks good. It's going to be good. And of course, it was good in the operating room. So 9 times out of 10, it's going to be really great. And you look beautiful. And I think the biggest thing is not only trusting the process, but just, get on with your life. Enjoy life, right? I mean, heck, you got engaged 6 months later?
Yeah, absolutely. I went on a trip, I think,
6 months later.
4 months later to Virginia, and then I went to Turks and Caicos to get proposed to. Surprise, maybe not so much, but you're telling me I didn't know. Come on. But carry on with your life. Go out in public with your tape on. It doesn't matter. I wasn't embarrassed. It's just part of the process, and people can mind their own business.
Oh, that's right. Listen, it's Dallas. I see my patients all the time in North Park on the weekend that have had their noses or faces done, and then I see them and walk. It's fine, nobody cares.
No, nobody cares.
That's true. I mean, just say, hey, great job. You look great. So, I mean, that's awesome. So I think that's wise words. So be patient, trust the process, and, be prepared. I think you said it so well, and, you had a great support system. Plus, I'm always available, by phone, by FaceTime, and I think that's really comforting. That's why I think, so many times, people always ask me, why do you give your cell phone out? And I said, because they're my patient, and it just takes away all of that angst, right? Because you go, oh my God, what's going on? And you go, and I look at you and I go, it looks normal. You're fine.
Yeah, it takes away all the feelings of anxiety, uneasiness, just knowing that I can send you a quick question or photo to make sure that I'm on track with everything, just because it's new and it's scary, and you're seeing your face and kind of a
beat up.
I don't want to say it, but yes, I mean, truly, you're a little bit bruised, you're a little bit swollen, and it's a different experience to see yourself like that. So it's nice just to take yourself down a level, send a quick photo or text, and then know that everything's okay.
Right, that's great. Wise words from Sydney. I'm going to have everybody look at this, okay? Know before you go. And she's absolutely beautiful. So thank you, Sydney, for sharing your great thoughts with us and your beautiful 2-year results. So
thank you.
Kudos to you. Give us your comments, give us your thoughts, and helping you become a better and more informed you.